Hi, and welcome to Crisis Management Part 1, History and Definition of a Crisis. This is in our first module. So when you think about crises, what might happen? Many of these may seem familiar to you, depending on where you've lived or what you've experienced. Certainly many of you have probably seen or participated in a blizzard in Minnesota, and hopefully very few of you have ever experienced a tornado. But as you can see, a lot of different issues can happen that can cause a natural disaster crisis. So in Minnesota, we most commonly see tornadoes, winter storms, power outages, floods, fires, and now a very infectious disease, COVID-19. So think about all the types of disasters that may impact a healthcare organization and your role as a healthcare manager. We've already mentioned natural disasters, but what about mass movements, landslides, mud flows, liquefaction, rockfalls, avalanches? Of course, perhaps not many of these occur in Minnesota, but you can certainly think about parts of our country or other countries where they in fact happen all too frequently. And then we have technological hazards, so structural fires, dam failures, hazardous materials incidents, and sadly, even nuclear accidents. And in the last several years, we've also had to think about terrorism and CBRN, which stands for chemical, biological, radiological, and nuclear. And don't forget, while all those seem to happen exterior to an organization for the most part, think about things that happen inside our organizations. Somebody commits a huge misdeed. Management takes actions that actually harm the stakeholders without suitable precautions. Or personnel crisis, a discrimination suit, management, employees, sexual harassment, deception crisis due to a lack of transparency from the management about certain information. Or workplace violence crisis, when a member commits violence to other members, bomb threats, hostage situations. Or skewed values crises, when short-term gain is favored and values are neglected. Scandals fall under this category. And finally, yet another type, rumors, when false information about an organization and its product hurt the organization's reputation. You may have been able to think of any one of these in the press that you've heard about, watched, listened to recently. So when we think back about crisis management, and do check out this sample chapter that I've quoted down on the bottom side, we've had crises since we know about the Earth being made. I'm sure the dinosaurs felt the same way. Hieroglyphics show cave dwellers dealing with crisis. Moses parted the Red Sea. Was this our first attempt at flood control? Modern day emphasizes crisis management. Remember the motto, be prepared? As a Boy Scout leader, I certainly heard that often enough. And we've had Hurricane Katrina, to name one, 9/11, earthquakes, major fires, the California wildfires that are continuing to burn even as I produce this particular lecture. In the 1970s, FEMA came along, Federal Emergency Management Agency. And then after 9/11, we developed a Homeland Security Advisory System regarding terrorist acts. So what is a crisis? Any event that is expected to lead to an unstable and dangerous situation affecting an individual, group, or whole organization. Crisis management, therefore, is the process by which an organization deals with a major event that threatens to harm the organization, its stakeholders, or the general public. Now, there's a lot of rules being talked about for a crisis. I like to think of the simple 5. Being unprepared is no excuse. Know the threats and get ready for them. You've got 48 hours, or usually it could be 48 minutes or less. Divide and conquer, and finally, get outside help. Why plan? Well, as I shared before, you certainly want to minimize the damage. You want to make sure that your staff and clients or your customers, your patients, your residents are safe. You want to make sure also to protect vital records and assets, allow for self-sufficiency for at least 72 hours, and provide for continuity of operations. When I created this slide, I was reminded of protect vital records and assets. Many years ago in Houston at the major medical center there, a flood, I believe it was due to a hurricane, And why they kept all of their rats in the basement along with their IT. They had history on 40 years, which means multiple generations of rats per year for major research into cancer. They lost them all. The IT, ever since that particular flood situation, most places do not put their IT in the basement anymore. It's certainly on a higher floor. And of course, we also now make sure that IT, any critical information, is stored in more than one location. So I live in Florida. We have a lot of hurricanes. We actually have some of the organization I've worked with actually had a duplicate version of their IT stored up in the Midwest. So consider prevention. How do you prevent a crisis? Well, you probably can't prevent the crisis, but you can prevent or help deal with it better than you might otherwise by anticipating and having a plan, responding immediately, don't overtalk, tell the truth, and accept responsibility. And when responding to a crisis, you want to make sure that you've got a set of planning scenarios and you've actually worked through them, a set of response modules, preset activation protocols, and clear communication channels. We will be covering each of these in detail in the following weeks. The purpose of this introductory lecture is just to get you familiarized with the terminology and to be thinking about what might be involved. So 4 phases of disaster preparedness everywhere you look. You have your disaster management plan, and you look at mitigation, planning preparedness, response, and recovery. So in mitigation, your goal is to act before a disaster strikes to prevent the occurrence of the disaster permanently or to reduce the effects of the disaster when it does occur. So again, you want to be looking at your hazards. What potentially could cause disasters? What resources do you have to deal with different kinds of resources? And one example given here is preparing a healthcare facility for a water crisis. So again, depending on where you're located, we have a lot of hospitals that like to be near the beach down here in Florida. We have water crises all the time. Planning preparedness, again, written plans, do a ton of education and training, and as we call it, practice the plan. And every time you practice the plan, you're going to evaluate how thorough it is, what were some unforeseen events that you had not adequately covered in your plan, and therefore you want to modify it. You may have personally participated in a drill. I certainly have, and I've certainly been part of managing a drill. And as you can see in my lower right picture, yellow triage area, where people are practicing what level of condition is the patient or the client in during this mock drill so that we know better how to prepare for them when we take them to the ER or wherever. So response, activities that help reduce casualties and damage, speeding recovery. So we will talk a lot about your incident command system. We will talk a lot about how do we activate response activities, what kind of support needs to be provided, and a COOP plan, which is redundant. Continuity of operations plan, in other words, called a COOP. So recovery, activities that provide a return to normalcy, and it includes both and short, long-term efforts. When you think about something like the pandemic we're experiencing, there is no short term. It is a long-term effort. So you have to be able to be prepared for the long haul. As you've read many articles or heard news stories over the many months, how staff would get absolutely exhausted in working their shifts and feeling no relief in sight. And then it sort of evolved throughout the whole country. New York was a place of ground zero for many of us, as was parts of California, Washington State, and Oregon. And therefore, those that followed certainly, hopefully, learned from what they were learning as they went along. Another aspect, social and economic risk factors. There is a very strong correlation between disasters and poverty. Think about it. Why? When you're doing your risk plan, you often think of populations as homogeneous, but they aren't. So social advocacy groups have worked tirelessly to raise the awareness of vulnerability of special populations, children, disabled, elderly, the poor, the immigrants. We will spend an entire lecture devoted on the topic of the vulnerability of special populations later in this 7-week period. For now, think about Katrina and its devastation. So many did not leave because they did not have the resources to leave. And after Katrina, given they had not left, it also hampered recovery. As people were hungry, they had nowhere to sleep, and You can look at the historical information about that experience. So, okay, crisis is over. Now, how do we recover? You've got to be able to carry on your business while the crisis is going on. For example, if you are running a hospital, there are other people that will come there in need of emergency care, elective surgery that may have been paused just for a brief period of time. So while simultaneously planning for how they recover from the damage the crisis caused. Crisis handlers must also engage in the recovery plan while perusing the goal. So a lot to think about as you learn about crisis management. For now, future weeks, we will go into each of these areas in more depth. For now, we turn to what we can learn from the history of crises and disasters and how crisis management has evolved.